Welcome back to American Medicine Today. I'm sitting alongside Dr. Bonati, and we're going to discuss some of the conditions that we treat at the Bonati Spine Institute. So why don't we start off by talking about something known as stenosis. Is that something degenerative in nature?
Stenosis is one of the most frequent problems that happens in individuals after 65 years old. So a population that is aging start to develop deformities inside of the canal, and those deformities restrict the exits and the pathway of the spinal cord or the dural sac or the nerves.
Okay. Can I ask you though, with stenosis, is that similar to arthritis?
Arthritis can produce deformities on the spine, and that will produce stenosis. So illnesses like arthritis or problems like accidents or situations of deformities, they will change the normal structure of the tube where the spinal cord is located, and in the lumbar spine where the corda equina is located. So the dural sac in that area.
When you say a corda equina, why don't you describe for the listeners and viewers what that is?
The corda equina is then a bunch of nerves that they go to different areas and they exit, and they are associated with affecting the motion of the muscles that they go to the leg. So one of the things that you need to know is when the canals, the central canal is affected, then if it is above L1, then the spinal cord is affected. And if it is below L2, L3, then the corda equina is affected. So the damage in between one and the other one by this compression is totally different. The area that where the spinal cord is affected will destroy the spinal cord, and they need to be decompressed as soon as possible.
Okay, for someone that's listening, what are the symptoms of stenosis? How could somebody recognize if they suffer from that problem?
You don't really recognize in the beginning. The people who has a spinal stenosis, they have weakness, but they don't really know. What they have is back pain. So they go, oh, I can walk, and they assume they can walk.
Right.
When you ask the question, you say, can you walk? And the patient say, yes, I can walk. And then you ask them,
how far?
Can you walk? How far can you walk? Well, I can go to the mailbox. And then what happened? My back hurt me so bad that I need to sit. It's not that the back hurts him to back, is that the root of the nerve is compressed, is giving him back pain, but he is losing, or her is losing the strength of the quadriceps, so the body cannot hold it.
Right.
Okay, the nerve the muscle cannot hold the body.
Right.
And when that happens is they need to rest. And the complaint is always back pain. So when they go to a doctor, they say, my legs are fine, I can walk, but I can walk because I have pain on my back.
Right.
The problem is the pain on the back appears before you start to have weakness that is going to force you to sit. So you need to explore that one with the patient. You need to go farther and say, can you walk how far? But the patient is going to blame his back pain to the cause why he cannot walk, but really is the opposite. Is the nerve is affected, then the nerve starts to pinch the root of the nerve that gives you the back pain. So the back pain now is the first symptom. That is how you diagnose stenosis, and that's how you understand the clinic of stenosis. Then you need to examine the patient.
Sure.
And usually what you do is you grab the leg and you push down on the quadriceps. I mean, you straighten the knee and say, do not bend your knee. I'm going to push down, and when you do, the leg goes down.
Does stenosis ever happen in the cervical spine?
There are stenosis also in the cervical spine. Any part of the bone structure of the spine has the possibility to develop stenosis. And when that happens, also the specific nerve is going to be affected. The difference on this is on the cervical spine is the spinal cord. So any damage that happened there, you can get paralyzed. Any damage that happens on the lumbar spine, you can paralyze a nerve. So for example, you injure a nerve, and then what happened is your quadricep doesn't walk. So you cannot walk with a quadricep, but if they put a brace there, and they can walk. But the problem is,
because it's giving us stability at that point.
Yeah, because at that time you don't have the strength. Okay,
right.
So when you affect the nerve in the lumbar area, you affect one nerve. When you affect the spinal cord on the neck, you are affecting everything. So it's a tremendous difference, the consequence of any damage in one side or in the other one.
So how does the Bonati Spine Institute's approach differ from other places that are performing spine surgery?
Well, our technique is different because we develop some type of a very, very different approach on the spine, cervical, thoracic, or lumbar, where the stenosis is. The difference is if you do open procedure, then the open procedure usually is being associated with a fusion. But I don't believe in fusions. Right. So I believed in return the structure to be independent and allow the nerves to perform normal. When you do a fusion, usually you restrict the nerves more.
And just to throw out figures, a one-level fusion yields a 65% failure rate, and a 2 to 3 level fusion, the failure rate escalates to 85%. So that's why Dr. Bonati does not believe in fusions and actually has patented methods and tools for hardware removal.
Yeah, we need to, once we have a situation that the patient comes to us with a stenosis plus a fusion, we need to undo the fusion, and then we need to take that instrumentation out, and then do the procedure that we develop.
Well, we hope that information was informative for all of you. I know it certainly was enlightening for myself. And if you have any other information, you can reach out to Bonati at bonati.com or call 855-267-0483. Join us again next week as we discuss more back problems and more on American Medicine Today.